Okay, let's talk about tissues. So thinking back to our first lecture of the semester last week, we were climbing the ladder. Okay, climbing the ladder as in the levels of organization. We kind of just introduced in that lecture the chemical level. We didn't really cover chemicals like atoms and molecules and bonds and that kind of stuff in this class. I do in physiology. So we just kind of skipped that level to the cellular level, which is what we talked about on Thursday last week. Talked about all those different organelles. Now we're at the next level, the tissue level. Okay, and we're going to talk about tissues throughout this lecture. Learned in that first lecture that there are four major types. You can call them the majors, the generals. Okay, these are the four most prominent tissues: epithelial, connective, muscular, and nervous. Each one is unique in what they do for us and the structures that they form. And we'll get into that here this morning. Now, before we do that, we're going to talk about how we develop our tissues for the very first time in our life. Okay, once again, just definition of tissue: group of similar cells and their intercellular substances, usually having a common embryonic origin and functioning together to carry out specialized activities. Real simplistic definition for tissue, just like a group of cells that function together. Think of them that way, it's pretty easy. We learned in that first lecture, histology is the science dealing with the study of tissues. Okay, now those four major types of tissues are going to be coming after these three tissues. These are the very first tissues, groups of cells that we have in our lifespan, and it all can be traced back to embryonic development. So we're talking about really, really early in the early stages of our life. In fact, we're going to start with talking about egg and sperm. Okay, and I'm going to kind of fill in those kind of blank areas with some very simplified illustrations. So bear with me, and I'm not the best artist in the world, but you've got your circular egg and your sperm with its flagella. And as we've talked, those each contain 23 chromosomes. And when those unite, that forms what's called a zygote, which is going to have 46 chromosomes. And that is how we begin our life. Okay? And that process is called fertilization. Okay? That single cell then starts going through mitosis. And this is going to result in one cell becoming two cells and two cells becoming four cells and whatnot. And a small number of cells is what we call an embryo. Okay. Then that just continues to grow and grow and grow. And we see more and more and more cells. And they kind of ball up, forming what's called a morula. Okay. The key feature of a morula is that it's a solid ball of cells. Okay. Whereas the next stage, we still have a ball of cells. I'll draw it like this so you can appreciate it, is that it's a hollow ball of cells. Now, a blastula is very, very important because this is what implants in the wall of the uterus. Everything that's taking place here is all still in the fallopian tubes of the female and the oviducts, uterine tubes, whatever you want to call them. And so a couple days after that fertilization and formation of a zygote, we get to this point And this is what sticks to the wall of the uterus, and that's going to be where that baby eventually develops, because that's what we commonly call the womb. Okay. What takes place next is the formation of our very first tissues in the body. That's what we call a gastrula, and then process called gastrulation. Okay, pretty cool. And I'm going to use some colored pencils to really show what's what here. Always looks to me like Pac-Man, but a 3-layered Pac-Man. And these, once again, are the first tissues in our body. Call these germ layers. And I color coded them because each of those 3 layers has a special name. In that light blue color, I drew in the ectoderm, the outer layer of cells. From that original layer of cells comes things like the epidermis of our skin. The epidermis is the very thin outer part of our skin, so the outside of our body. The inside epithelial lining of our mouth and rectum, most structures of the nervous system. So quite a important set of features. Mesoderm there in that kind of light green is the middle layer, makes up, structures, or eventually forms the bone, so our skeleton, our muscles, muscular system. The deeper layer of our skin is the dermis, the circulatory, cardiovascular system, so most parts of like the heart and blood vessels. Excretory system would be like the urinary system, reproductive, and then most of the layers of our respiratory and digestive systems. And then finally there in pink comes the endoderm, which is going to be a lot of the linings of different things. So like the innermost parts of our respiratory and digestive tracts. So like the inside of your stomach, for example, inside of your trachea, associated glands of those 2 systems, and then the inner lining of our bladder. So a lot of very important structures that we will cover in this semester can be traced back to this funky looking little Pac-Man like structure. And then eventually, what we'll talk mainly about here today are the 4 major types of tissues. Epithelial tissue is going to cover our body surfaces and line hollow organs, body cavities, ducts, and form glands. So there's 3 main functions. It's going to act as a selective barrier to limit or aid the transfer of substances into or out of the body. Contains a secretory surface, releasing products produced by cells onto their free surfaces. That's going to involve glands, and then acts as a protective surface, resisting abrasive influences of the environment. So that would be like, your epidermis of your skin, the inner lining of your mouth, which are, subject to abrasive things. Okay? Whether it's, something scratching your skin or, a scratchy piece of food on the inside of your mouth. Connective, this is the most variable, like blood is a connective, so's your bone, so's cartilage, but also fat. And so there's a lot of different functions. It protects, supports, binds organs, stores energy as fat, provides immunity. Muscle, there's 3 types of muscle. All 3 generate physical force needed to make body structures move, whether that's, like our arms and our hands as we're taking notes, or like our heart as it pumps blood, our stomach as it helps digest food. And whenever a muscle contracts, it generates quite a bit of heat. We take advantage of that on like a cold day. We shiver to produce a lot of body heat when we get cold. And the nervous system, or nervous tissue, detects changes in body and responds by generating nerve impulses. 4 images at the bottom are just kind of showing you differences between the cells. Not something I'm going to ask you to know for the exam. One thing you can see right away in our picture of epithelial tissue is how the cells are tightly put together. Okay, the cells are really close to one another. We see the kind of same feature in muscle tissue, whereas connective tissue and nervous tissue, we don't really see that. We see the cells are kind of a lot more spaced apart. Okay, and you don't see these things that we're going to talk about on the next page and connective and nervous like you do in muscle and epithelial. And those things are cell junctions. Okay, so what are cell junctions? These are the points of contact between adjacent plasma, or, if we wanted to call it a cell membrane. Remember, the plasma membrane is like the walls of the room, okay, that connects cells to one another, but also, keeps stuff on the inside and stuff on the outside of the cell, okay? So in other words, when you've got cells put together in epithelial tissue where they're connected to one another, you have cell junctions. Same thing for muscle tissue. You don't quite see cell junctions in connective or nervous, okay? Down here in our illustration, we show all 5 types, okay, associated with this singular cell. And then you can kind of see parts of a neighboring cell. First type are called tight junctions, where there are web-like strands of transmembrane proteins fusing the other surfaces of adjacent plasma membranes together, which seals off passageways between adjacent cells. Okay, there's a lot of kind of technical terms in there. The importance of tight junctions is that they are fluid tight. When something is fluid tight, that means it's not going to leak. Okay. And like, the Dr. Pepper bottle that I see back there by Tia, hopefully with the lid screwed on there nice and tight, if you were to turn that bottle upside down, it would be considered fluid tight and it wouldn't leak out. Okay. Last week, we talked about cavities, like the cavities around your heart and lungs, where there's serous fluid. We want that fluid to stay in those cavities. So the cells that line those cavities are going to be held together to one another via these tight junctions to prevent the fluids from leaking out in other places of the body. Okay. Adherence junctions down here at the bottom. Key feature of them is that they contain plaque. And yes, that's the same type of plaque that will gather on your teeth if you don't do a good job of brushing your teeth. What is plaque? It's a dense layer of proteins. In this case, it's on the inside of the plasma membrane. Attaches both to the membrane proteins and to the microfilaments of the cytoskeleton. Function of them is to prevent epithelial surface separation during various contractile activities. So in other words, it prevents cells from basically separating when the muscles of the body contract in places like our intestines, when the smooth muscle contracts and moves the food forward. Okay? So in other words, it keeps your intestines from kind of just like splitting apart. Very similar to those in function are desmosomes, which also contain plaque. They also have transmembrane glycoproteins extending into the intercellular space between the adjacent cell membranes and attaching cells to one another. We have these in our epidermis. So once again, the epidermis is the thin outer portion of our skin. So it prevents those cells from separating as our skin stretches and is pulled in different directions. We also have these with our cardiac muscle cells in our heart. So in other words, it prevents your heart cells from just like ripping apart from one another. Obviously very, very important. Okay. Now looking at figure C versus figure D, they look fairly similar. Kind of what you see, the big difference is that a hemidesmosome is going to contain about half the structures as a desmosome. In fact, the prefix hemi means half. Okay. A hemidesmosome resembles desmosome, but they don't link adjacent cells, but instead anchor cells to what we call the basement membrane. Okay. And the other day, I kind of used the room that you're sitting in, whether that's here in Atchison or there in Wamego, as kind of a way to visualize a cell. Okay. Well, all rooms and all buildings, like the one there in Atchison, one here in Atchison, the one in Wamego, are sitting on a foundation. And like a house that you have, a foundation is equivalent to the basement membrane that we see in the body. Okay, basement membranes are non-cellular materials, and they help hold the cells to them, just like the foundation of your house that's made up of concrete that's buried in the ground, and then the house itself is bolted to it. These are like the bolts that hold your house to the foundation that keeps your house from blowing away, you know, when there's a big windstorm like we had about a month ago. Okay, so a hemidesmosome doesn't connect to cells, but instead connects the cell to the basement membrane. And then finally, what I find are the coolest ones, I think anyway, what we call gap junctions, contain proteins called connexins that connect neighboring cells. Basically, these are like doorways that enable chemicals to flow from one cell into another. Those chemicals include ions and other small things. We have these in only a few special places. And our heart is one of the most important places where we have these. And that enables a nerve signal to travel from cell to cell to cell to cell. And that allows for all those cells to basically contract at the same time. And it makes a really efficient contraction of the heart. Stuff we don't really get into too much in this class, but I do much so in physiology. As far as the pictures go, don't worry about them. Just the information there at the top. We've got plenty of other pictures to worry about. All right, what we're going to do now is jump in on the 4 types of tissues. Keep in mind, there aren't just 4 tissues in the body. Those are the primary types. So there's forms of epithelial. We'll cover those first. Then we'll talk about like the 10 or 12 different connective tissues. Then we'll talk about the 3 muscle tissues, and then finally we'll talk about nervous tissue at the end. Okay, let's talk epithelial tissue. As I already kind of explained, one of the key features of epithelial tissue is that the cells are really packed together. Okay, we have what we call closely adhering cells arranged in continuous sheets, either in a single or in multiple layers. Okay, we classify epithelial tissue into 2 general types: surface and glandular. A surface epithelium, which there's covering and lining epithelium here, is going to form the outer covering of our skin, some of the internal organs, as well as the inner lining of structures like our blood vessels, the ducts, the body cavities, the lining of our respiratory, digestive, and urinary reproductive systems. So we either have it covering something, so we call it covering epithelium, or it's going to be on the inside. It's going to be the lining of that structure, so it'd be the lining epithelium. We're going to talk mainly in this lecture about surface epithelium. The main types that we talk about are classified as surface. Okay. Glandular epithelium makes up the secreting portion of glands, like our thyroid glands that produce, or thyroid gland, there's only one of them, that produces specific hormones, adrenal glands that also produce hormones, but also things like your sweat glands in your skin that produce sweat, digestive glands like those that are in your stomach and intestines that help with digestion. Your salivary glands would be another example of a gland made up by glandular epithelium. Okay, like I said, we're going to spend the majority of our time talking about surface epithelium. So the next several slides will be about that type of epithelial tissue. Okay, looking here in our illustration on the bottom left, we have a 2-dimensional representation of some epithelial cells, and therefore an epithelial tissue. There we see sitting on top of the basement membrane, like the foundation of a building, like I was talking about on the previous page. And then deep to that is a layer of connective tissue. This is a pretty normal representation of the relationship in the body between epithelium and connective tissue. For example, in our next lecture, which we'll probably get to next time, we'll talk about the epidermis, which is epithelial tissue. Then you'll talk about and then we'll talk just briefly about the basement membrane that separates it from the dermis, which is made up of connective tissue. So you see this situation a lot in the body: epithelial, then a basement membrane, then connective. Now, once again, kind of thinking about the room that you're sitting in, which I've been in both rooms and I know the shape of them, fairly square room, okay? I probably shouldn't use the word square. I'm going to use the term cube, okay? Because I want you to visualize and think of cells in a three-dimensional sense, okay? Square is more two-dimensional, which has how many sides? 4, right? Okay, well, I use the term cube because how many sides are on a cube? Like this room, there's not 4 sides, but there's 6, okay? Because you got the 4 walls, but you've also got the ceiling and the floor, okay? This is a two-dimensional illustration that doesn't do a great job of showing you that there are 6 sides to these tall column-shaped cells, but I promise you that there are, okay? There's 1 apical surface, 4 lateral surfaces like the walls in the room, and then the floor or the bottom of the cells is what we call the basal surface. Each of those surfaces is going to differ in its structure and function. The apical or free surface, kind of like the ceiling of the room that you're in, is going to be what faces the body surface. So in other words, this is what is facing outward from your skin. It's going to be what lines the inside of a body cavity or the lumen of an organ or a tubular duct. Okay, so this is what like faces the inside of your stomach, inside of your mouth. Okay, this is where you're going to have those special structures like cilia or microvilli if the cells have those special features. Remember cilia we talked about the other day, tiny little hair-like extensions off of a cell that help push stuff along. Microvilli look like little fingers that increase surface area for absorption and secretion. Okay, lateral surfaces are going to be what face adjacent cells on either side and may contain a cell junction. So in other words, this is like the walls of a room, and they're shared, like between this cell and this cell. Okay. And then opposite the apical surface is the basal surface. This is where we have those hemidesmosomes adhering to the extracellular materials. So like the floor of the room and the bolts that hold it to the what we call basement membrane. Basement membrane is a thin extracellular layer, so it's not cellular, it's extracellular, outside cells. Commonly consists of 2 layers, and you can see them labeled here: basal lamina and the reticular lamina. Those just kind of help separate the epithelial tissue from the connective tissue underneath. Now, I do want you to know this image. It's not my favorite image on earth, but it does show you those things that I talk about or just talked about. Don't worry about nerve and blood vessel at the bottom, but the other things I want you to know. Okay. I'm not going to worry about you knowing the figures on the right, but I'm going to talk about them because those are very important to understand for understanding the makeup and how we name our epithelial tissues. Okay, generally epithelial tissue is named for kind of 2 features: how many layers are found in that tissue, and then the shape of the cells. Okay, if we describe the tissue as being simple, it means it's only got 1 layer of cells. Okay, whereas stratified, that's basically just a fancier word for layered. Okay, in other words, stratified, we've got more than 1, so it's at least 2. In many cases, what we might find are hundreds of layers. Okay, pseudo-stratified begins with the prefix pseudo, which you may have seen before, is a prefix that means false. Okay, so pseudo-stratified is not multiple layered, even though it looks like it is. Okay, and looking at this illustration, it looks like you've got maybe 2-3 layers of cells. Okay, well, here's why it looks this way. Okay, some of the cells, like this one here, are really short. and therefore the nucleus is kind of down here at the bottom of the cell. Whereas like right next door, we've got a cell that extends all the way to that apical surface that we were talking about. And this cell is really tall, so is the one on the other side of it. And its nucleus is up here. The nucleus of this cell is up here. So it looks like you got some cells that have, or there's a layer of cells here, there's another layer of cells here. When all actuality, it's the same layer of cells. Some of them are just shorter than the others. Does that make sense? Okay, so those are the way that we describe epithelial tissue based on the number of layers. We use another term to describe the shape of the cells. Squamous or squamous, I've heard it pronounced. Think of them like they're squashed, like they've been sat on, they're really flattened. Okay. These cells are really, really thin, and that's great because they are going to be easily passed through by certain things. Okay. We find these in places like our lungs, where we need to exchange materials, and we perform what's called diffusion. So this is like how oxygen goes from our lungs and into the bloodstream. It has to pass through cells, and by having really thin walls or just being really thin in width, it's really easy for something to pass through it. Okay, be a lot easier for oxygen to pass through a cell like this than to pass through this. Okay, this is like taking 2 steps versus like taking 200 steps. Okay, does that make sense? Okay, cuboidal have cube shapes. So they're roughly the same width as they are in length. And then columnar, they're tall, rectangular. They are taller than they are wide. Okay. I don't have an illustration to show you transitional epithelium, which is not a shape, but tells you what happens to the shape. Okay, the tissue, the cell shapes can change. In some cases, in some situations, the cells might be more cube shaped, and then in others, they might squish down and become more squamous. This is where we don't have this very commonly in the body, only in places like our bladder, which we need for the purpose of stretching. Okay, by squeezing down from cube shape to squamous, that basically just enables the bladder to expand a little bit more and hold more urine. So that's transitional epithelium. All right, any questions on those? So first tissue we're going to talk about is simple squamous epithelium, which tells us we've got one layer of cells, and the cells are squashed. They're flattened. Okay. Now, what we're going to do for the remainder of the lecture is basically talk about each individual type of tissue throughout the body, or at least most of them. And I give you a little bit of information about each one, and then we've got some microscopic pictures showing you what they actually look like inside the body to really, see what's going on in the cell shapes and that kind of stuff and those features. Okay. Rarely, not very much of the information that I give you about them will show up on the exam. So I'm not going to probably ask you, where do you find simple squamous? Okay. It's on the inside of our heart, blood vessels, lymphatic vessels. That's going to have a special name called endothelium. If it's inside of our serous membranes that we talked about the other day, like around the heart, pericardium, and the pleura, we call it mesothelium. I'm not going to ask you those kinds of information. Okay. That kind of information. I want you to, learn it, obviously, but I'm not going to test you on it. Okay. What you'll see on the exam are quite a few of these pictures, okay, where you're going to see these clinical pictures and have to identify what tissue is illustrated. These are pictures that you don't find in your labeling packet. Okay. But if you go back into Canvas, let me show you. I have created essentially a little document where you can click on this one here. It says tissue pictures, and I just put them all in one little document. There we go. So I've got them all just kind of compiled. So if you wanted to, which I've printed the ones here in Atchison off for you guys, but for you guys in Wamego, if you wanted to print those off, you can make flashcards with them or something like that. That might be handy. Now, looking at simple squamous, once again, we have a single layer of cells, simple, and then the squamous tells us that we're dealing with flattened plate-like cells. We've actually got 3 different images to show you the same tissue. Okay, we've got them viewed from different angles, essentially. Okay, we've got 2 sectional views and then a surface view. Looking at this surface view where you can, see the cells, does it look like we've got 1 layer of cells there in this view? Probably not. Looks like actually there's a whole bunch of, kind of oval shaped cells. Okay, what you're looking at in this picture, okay, is a different angle than what you're looking at for this picture and this picture. Okay, looking at this picture, I zoomed in really, really far. Basically, if I were to highlight that portion of the figure, that's the simple squamous. Okay, that's where you can see 1 layer of cells and they are really thin. Okay, well, looking at this picture, basically you're just looking like if I were to draw an arrow like this, looking down at the top of those cells, that's what this view is. Okay, so it's really hard to show simple squamous here. This picture is just so small, it's hard to show it there. This is a really great illustration. I shouldn't say illustration, it's a great picture showing you simple squamous. This is what we call a capillary. This is the blood vessel that is found where we perform what we call exchange. So for example, this is where oxygen leaves the blood would be here. It travels through the very thin wall of these epithelial cells and into your muscles or into your brain. Okay. Remember, the thinner the cell is, the easier substances are able to pass through. Okay, so a capillary is a very thin-walled blood vessel because of the fact that it's got simple squamous making it up. So if I were to put a picture on the exam of simple squamous and ask you to identify it, this would be the picture. I wouldn't use those other 2 pictures. Does that make sense? Okay, simple cuboidal is our next tissue. Once again, simple, we've got a single row. Cuboidal tells us that those cells are cube-shaped, and in many cases, these cells are going to have microvilli, those little finger-like extensions that make them great for like absorbing and secreting, producing mucus. So we find them in a lot of our glands, liver, thyroid, mammary, salivary, bronchioles, which are in our lungs, and kidney tubules, obviously, in our kidneys. Okay. This is a great picture to show off. You can really see nice and cube shaped, and we've got 1 layer of them. Okay, this happens to be in the urinary tubes of the kidney. Like I said, kidney tubule, same thing. Over here is showing you just a different way to show the same thing. Okay, a kidney tube's like a pipe in our kidneys that do different things that we will talk about later on the semester. But it kind of looks like, looking right here, we've got 2 layers of cells, doesn't it? Okay. Well, basically, if you were just kind of draw a line to break those apart, this is a kidney tubule, this is another kidney tubule. So these are just like neighboring tubes, and that's why it looks like. So I would cut this part out of the picture. If I chose a picture for the exam on simple cuboidal, it would be this one. All right, simple columnar. We've got a single row of tall and narrow cells, very similar to what we just talked about with simple cuboidal, a lot of absorption and secretion taking place. Looking at our figure, you see where the number 9 is, this nice kind of squiggly red line. That's the basement membrane. So in other words, from here where the number 8 is down to here, this segment is the simple columnar. Okay, and you can see very tall, very obvious that we've only got 1 layer of cells, although these number 7s that kind of look like a football, those are what we'd call goblet cells. They produce mucus. I just know that. You don't have to know that specifically quite yet, but They are one of the types of non-ciliated simple columnar, okay, which means that they don't have cilia. Okay, there's also columnar epithelial cells that have microvilli instead of cilia. Okay, but I would probably guess that the majority of our simple columnar would be the ciliated form, meaning that they've got cilia. And in fact, where that number 8 is, you can see that's where the cilia would be to help move different things. You know, you can see where those things are at in the body. All right, so that was simple columnar. Pseudostratified, once again, tells us that we've got a single row, although it doesn't appear to be, and that's because some of the cells are short. They don't reach the surface. Okay, looking at this figure at the bottom, all this red stuff at the bottom, that's connective tissue. So, you know, you draw a line across from here outward in kind of the purple shaded and then gets kind of pink out there towards the outside. That's the pseudostratified, okay, where you look like you have multiple layers, but in all actuality, it's one layer. We see where the number 11 is, you kind of see the wispiness to it. That's ciliated forms. There's also non-ciliated forms. So it's very similar to what we just talked about with simple columnar. Okay. Ciliated forms are found in the upper respiratory tract and ducts and many glands, the epididymis, which is the structure in the male reproductive system. And then in the male urethra, there's non-ciliated forms. So, questions? Okay, so those will be the single layered epithelial tissues. Now we're going to talk about the stratified epithelial tissues, starting with stratified squamous. Now there's two forms of stratified squamous: keratinized and non-keratinized. We'll start with talking about keratinized. Keratinized has keratin. Okay, that's why we call it keratinized. So what is keratin? Keratin is a protein that helps waterproof and is very resistant to friction. We only have keratinized stratified squamous in the outer layer of our skin, what we call the epidermis. And we're going to talk more about this in our next lecture when we talk about the skin. Okay, looking at our figure, you can see kind of this orangey stuff. That's all connective tissue. So it's this kind of dark blood red colored area. And then it even includes this kind of wispy stuff out here on the outside. Okay. What we have for our epidermis are cells that are loaded with keratin. And when we form the cells of the epidermis, we form them down deep in the epidermis and we start eventually just replacing them, pushing them outward. Eventually, by the time those cells move to the outside, they become just dead cells that we're flaking off and scratching off and rubbing off all the time. And we can see that they basically are just starting to disconnect from the body altogether. Okay. If you didn't know, a lot of the dust that collects in homes is actually from dead skin cells that have flaked off of you and your family members, which is gross, but that's what it is. Okay. Non-keratinized, and you can see really nicely the shape of the cells here, does not have keratin. That's why I call it non-keratinized. Okay, so it's not going to have that really strong protein. A key feature of this is that it's going to create a moist, slippery layer. I know everybody loves that word moist, but it's nice and wet, whereas like our skin is not. Our skin is dry. Okay. We have this on like the surface of our tongue, on the inside of our mouth, inside of the esophagus, and in the vagina of a female. Okay. So that's non-keratinized. It's all this purpley shaded portion of our figure. Okay, stratified cuboidal. not prominent throughout the body. It says it's fairly rare here with this bullet at the bottom. Don't think like some people have it and some don't. It's not rare from person to person. It's just that there's not a lot of it throughout the body. Okay. Once again, stratified tells us we've got multiple layers. It looks like probably 2 layers in our figure here, and very nice to show that they are pretty cube shaped. And we find them in sweat glands, esophageal glands, part of the male urethra, just not a whole lot of places. Kind of the same situation for our next epithelial tissue, stratified columnar, also fairly uncommon or rare. We find it in ducts of the esophageal glands, the anal mucous membrane, the conjunctiva of the eye. Looking at the figure here, you know, it's from the number 12 up here to the top. We can see definitely a layer of cells down here at the bottom, maybe another layer there, but then there's definitely another layer here at the top. So at least 2 layers, which is why we call it stratified columnar. All right, transitional epithelium. Once again, doesn't get its name because of the shape, but what can happen to the shape of the cells. And that's why we've got 2 different pictures here. One where the cells are nice and kind of more rounded, more cube shaped, and they're what we would call relaxed state. Whereas, if I can move my page down, they can become more compressed, more flattened, like they would become squamous. That layer, therefore, where that transitional epithelium stands down, here it's cut quite a bit wider, which is going to permit distension. Distension is just a fancy word for stretching. Like I said, we don't have a whole lot of this in the body of the bladder, the ureters, the urethra. Okay, so associated with the urinary system, and some places will actually describe it as like urinary epithelium for that reason, because it's really only found in the urinary system. Excuse me. All right, once again, those were all surface epithelial tissues. Okay, remember there's 2 major categories of epithelial tissue, surface and glandular. Now we can talk just briefly about glandular. We'll talk more about glands in our next lecture. So we probably won't get to that till Thursday. But glandular forms the glandular cells that lie deep to the covering lining epithelium. So the epithelial tissues that we just talked about, this is deep to it. Okay. Function of glandular epithelium is to secrete, okay, to release substances. Glandular epithelium forms glands. So defining what a gland is, it's a cell or group of highly specialized cells that secrete substances into ducts, onto a surface, or into the bloodstream. There's 2 types, exocrine and endocrine. We're going to talk a lot more about exocrine in our next lecture. That would be like what your sweat glands are, your salivary glands, your earwax glands, mammary glands in a lactating female. Key feature of exocrine glands is that they are always going to have a duct, like a pipe or a tube that carries their secretions either onto the surface, so like the skin surface, like where oil and sweat collects, or into a cavity, like in the inside of your mouth or inside of your stomach. Okay. Endocrine glands, like the thyroid gland that's pictured down here at the bottom, they do not have a duct. Instead, the products that they produce, what we call hormones, are going to be released and eventually picked up by the bloodstream. So they just diffuse out and into the bloodstream, where they're then carried to places throughout the body, you know, to produce a physiological response. You know, in the case of the thyroid gland, it produces hormones that regulate our metabolism. So those hormones go places like our liver and our muscle cells. We have an entire lecture dedicated to the endocrine system. So we'll talk about all the endocrine glands, your pituitary gland, your thyroid, the parathyroids, the adrenals, and so on and so forth. So we have that to look forward to. That's a little bit down the road, though. All right, and that wraps us up with epithelial tissue. So we can move now into connective. Go for it. It'll be go up and then take a left all the way down the hall, and you'll take a left again. So take a left after the pop machine. All right, connective tissue. Very different than epithelial tissue. One of the key features of connective tissue is that the cells are very widely separated or spaced. Okay, so in other words, they're not jam-packed on top of one another in multiple layers or in single layers like our epithelial tissue. Instead, they're separated by what we call extracellular matrix, which is just the material between the cells. Okay, well, within this extracellular matrix is what we call ground substance, just unstructured material. A lot of that's mainly water, and depending on the type of tissue that you're dealing with. But that fills the space between the cells, and then there's fibers, 3 fibers. Those are the 3 things that you wrote out. We'll talk a little bit more about those. Okay, but those give special features to our connective tissues. Some of them are stronger because of the tissue or the fiber that they have. Some of them are stretchy and that kind of stuff. So we'll talk about that here in a little bit. I've already mentioned this morning, but this type of tissue is the most abundant and variable type of tissue. Okay, for example, you know, your bone, your blood, your fat, your cartilage, those are very, very different from one another. So there's a lot of variability, and there's also a lot of differences in functions. Okay, a lot of functions. It connects organs, hence the name connective, supports and protects, it stores energy, produces heat, moves, transports materials, and provides immune responses. Okay. Now, even though those different connective tissues are very different, there are some similarities, and we can talk about some of those right now. Tracing back to the embryonic state here, once again, very shortly after conception, embryonic stem cells from the mesoderm, remember that's that middle layer of the thing that looked like Pac-Man, give rise to the many types of connective tissue cells. Each major type of connective tissue contains an immature class of cells that ends with the suffix blast. And we see 3 examples: fibroblasts, chondroblasts, osteoblasts. Okay, these are immature cells that have the capability to undergo cell division. So in other words, they can produce more cells, and they are what produce that extracellular matrix, that material between the cells. Once they've done that, then they can differentiate into mature cells that then end with sites. So like instead of being called an osteoblast, it would be called an osteocyte. Okay. The type of connective tissue cells vary according to the type of tissue, and they include the following. Fibroblasts are large flat cells with branching processes, are the most numerous of our connective tissue cells, and are found in most of our connective tissues. Okay. Adipocytes, that's just a fancy way to describe our fat cells or adipose cells. They store a type of fat called triglycerides. They're going to be found obviously in our fat tissue or adipose tissue. Mast cells, abundant alongside blood vessels that serve our connective tissue. They produce a chemical that's called histamine. That is part of the inflammatory response. Unfortunately, histamine can be very annoying to the body, and that's why people might take an antihistamine. You might know why people take antihistamines. You take them when you're allergic to things. So an antihistamine, I imagine some of you have heard that phrase before, is just something in an allergy medicine. Okay? So histamine can cause things like itchy skin and dry eyes and a runny nose and that kind of stuff. So that's kind of a side effect, unfortunately, of what a mast cell does for us, but they do good things for us as well. They can, or at least we believe anyway, ingest and kill bacteria. Okay. Now, mast cells are not immune cells. Well, I mean, they help with immunity, but most of our immunity comes through our white blood cells. Okay. Not typically found in large numbers in normal connective tissue outside the blood, in other words, but in certain conditions, they can migrate from the blood into other connective tissues. You know, like if you get a cut and bacteria has got into the dermis, then the white blood cells can leave the blood and go and clean things up. Okay. These last 2 cells here, macrophages and plasma cells, are
very sophisticated forms of white blood cells. Macrophages, I've already kind of talked about Pac-Man today, but these guys are the cells of our body that actually act like Pac-Man. They don't look like Pac-Man, but they act like him. And if you don't know who Pac-Man is, a video game character that just gobbles things up. Okay, his job, macrophages are anyway, are to swallow up and digest viruses and bacteria and toxins. We call that phagocytosis. You'll hear me talk a lot about those later on the semester. Plasma cells are the cells that produce our antibodies. So our various immune responses, plasma cells can be involved with that. Okay. So those are the cells. Now we can talk about the function, or excuse me, the functions of the tissues, which are in many cases a result of the three types of fibers that you might find. Okay. Once again, fibers are found in the extracellular matrix, and they include collagenous fibers made up of a protein called collagen. Collagen is a very strong protein, gives great tensile strength to things like our tendons, our bones, our ligaments, the deeper layer of our skin, places that need to be resistant to physical forces. Okay, our bones need to be strong. So do our ligaments, which hold our bones together, like the ACL and the knee. Tendons connect our muscles to our bones, so we need them to be very strong. And then our skin, we don't want that just ripping and tearing, so it needs to be very strong. Okay. Reticular fibers occur in networks and provide support for smaller structures like capillaries and nerve fibers. They're made up of collagen, but are more highly branched. And then elastic fibers, just hearing the word elastic might elicit a thought of like a rubber band or like a waistband in, you know, a pair of gym shorts or some sweatpants. Okay. Elastic fibers made up of a protein called elastin. It enables tissues to stretch and recoil like a rubber band. Okay. To stretch and then snap back to its original shape. And we find these fibers in places like our skin, which is great because our skin needs to stretch and then recoil. Unfortunately, as we get older, some of that goes away, like an old pair of sweats that are stretched out to the point that they, you know, are more likely to fall off your butt. That explains why we get wrinkles, and as we get older, our skin starts to kind of flail in the wind. And then other structures like your lungs and your arteries also need to stretch. So elastic fibers will be found there. Now, because of the diversity of cells in the extracellular matrix and differences in their proportions, classifying, kind of organizing connective tissue is kind of murky. So our textbook offers this kind of setup, this outline. They've broken things down into embryonic and mature. We're not going to cover the embryonic connective tissues. We're going to focus on the ones that we have as mature adults. And as you can see, there's 3, 6, 9, 11, 13 of them that we're going to cover. So that's plenty. We don't need to cover 2 more. As far as the image on the right there, don't worry about it. It just shows you cells and the different fibers, but not something I'm worried about you knowing. All right, what we're going to do is we're going to start with the 3 loose connective tissues, and we call them loose connective because the cells are really separated from one another, and you can see that right away with our first type, which I always tell students it looks like something my 3-year-old would draw. Okay, lots of dots and squiggly lines and no real rhyme or reason as to what's going on. Areolar is going to contain all 3 fibers. So all these little lines that you see, those are the 3 fibers: the elastic fibers, the collagenous fibers, the reticular fibers. The little dots, those are the fibroblasts, those cells that I talked about. We find this in places where we need to provide passageway for nerves and muscles. And in our next lecture, when we talk about the hypodermis, which also goes by the term subcutaneous layer, we will also find this type of tissue there. So we'll talk about areolar in our next lecture. Okay, reticular has reticular fibers. That's the key feature of reticular tissue, okay, hence the name. It looks like areolar where you've got kind of dots and squiggly lines. Those squiggly lines, though, have to be reticular fibers only. Okay. We have this in like our lymph nodes, our spleen, and our bone marrow. And we'll talk about reticular tissue at that point much later in the semester. And then adipose tissue or fat tissue, as we would commonly call it, looks like you've got a bunch of big open cells with nothing inside. Looks like they're just big empty cells. Okay, well, the emptiness is not actually just void of nothing. That's where the fat is. Okay, so they have a lot of fat in there, and everything else just gets pushed up against the plasma membrane. So you can see all these little red dots. That would be the nucleus. But you're also going to find that the other organelles more than likely are pushed up against the plasma membrane because of the fat that's stored inside. Unfortunately, our body has an unlimited ability to store fat. So that can explain why people can get very large. Don't consider fat as always a bad thing. We need it. It gives us energy, it insulates, and it cushions. But unfortunately, too many people take full advantage of this unending ability to supply it, to store it, I mean. All right, so those were the 3 loose connectives. Now we're going to talk about the 3 dense, and we can see in our 3 pictures here that the cells and the fibers are much more tightly packed together. We'll start with our dense regular and then dense irregular connective tissues. Very similar. Both are very strong connective tissues. The difference relates to the direction in which the fibers are running, okay? In regular, the key is that the fibers are all running parallel to one another. All those collagen fibers are running in the same general direction. The cells, those fibroblasts, will be present between the bundles of collagen. This type of tissue is found in our tendons and ligaments. Tendons, once again, attach muscles to bones. Ligaments hold bones together, like the ACL and the MCL and the knee. Structures that generally get pulled in on like 2 different ends. Okay, think of this tissue like a woven rope. Okay? If you pull 2 ends of a nice woven rope, it's really strong. Okay, because of the fibers in the rope. And if you were to grab the rope and pull it from like the center and pull it apart, it will come, unwoven. Okay, that would not be good. Thankfully, like our tendons and our ligaments don't get pulled in those directions generally. But we do have structures that need to withstand stress in all different directions. And in those places, we're going to have what we call dense irregular connective tissue, where those collagen fibers are just kind of running all sorts of different directions so that they can withstand those stresses applied in those different directions. Places like our skin, the dermis of our skin, we need this type of tissue. The fibrous pericardium that surrounds the heart also will have this type of tissue. All right, and then we also have elastic connective, or as you can see, sometimes you'll see it listed as dense regular elastic connective tissue. The key here is that obviously we have elastic fibers, which is going to allow for stretching and recoiling. Okay. This is found in our lungs that have to expand or stretch when we take a deep breath in, and then when we exhale, they need to push inward and allow the air to flow out. Arteries, respiratory pathways, our vocal cords, and even some ligaments will have a little bit of this in it as well. Okay, any questions on these? All right, let's talk cartilage. Yeah, what's up? So like when a person smokes, is that what you're just asking? Yeah, absolutely. So like basically a very common lung disorder is emphysema, right? You've probably heard of emphysema. One of the telltale signs of somebody that suffers from emphysema, they call it a barrel chest, where it just looks like their chest is really pushed outward. Basically, in that situation, a person's lung has become like a stretched out waistband, okay, where it's stretched really well, but it's lost that recoil action. So people with emphysema, they don't have that recoil of their lungs, so it's really hard for them to exhale their air out. Okay? Their lungs are overinflated almost all the time, and a lot of that is because of the smoking, because that's the main reason people get emphysema. Very good question. All right, we have 3 types of cartilage to discuss: hyaline, elastic, and then fibrocartilage. Cartilage is different from our other connective tissues because it's only got the cells called chondrocytes. Okay, they're going to produce the fibers and the tough extracellular matrix that our cartilage will have. Okay, the fibers of cartilage form a dense network of collagen and elastic fibers embedded in a gel-like round substance. Unfortunately, the blood supply to cartilage is pretty low, and available nutrients therefore is very slow. Which explains why if somebody has like cartilage damage, like in their knee or their hip or whatever, it's not going to heal itself very well. You need nutrients to heal damaged tissues. Okay. Most abundant type of cartilage that we have is hyaline. Key features that is very rubbery. The matrix is very rubbery, so it's bendy and flexible. There are cluster chondrocytes. Those are the cells that you can kind of see in white here, kind of periodically. And then there's fine collagen fibers. We have this in a lot of different places. It's at the end of our long bones. It forms what we call the growth plate in a growing bone. This is how our ribs connect to our sternum, the tip of our nose, most parts of the respiratory system, or the respiratory passages, I should say. It is going to provide smooth joint surfaces. That's going to be this part here covering the ends of long bones, and then flexibility and support. All right, elastic cartilage has elastic fibers. It's basically just a hyaline cartilage, but with elastic fibers, which is going to provide a lot of flexibility and elastic support. This is what like your external ear is made up of. And that explains why, if you got in trouble as a kid, like I did, and your parents twisted your ear, it snaps back to its original shape and doesn't just stay in that twisted position. And then your epiglottis that helps us not choke. Very important. Fibrocartilage has an extensive amount of collagen fibers, which makes it really strong and tough. And we have this in places where we need to resist compression and absorb shock. It's found between all of our vertebrae, what we call our intervertebral discs, between our 2 hip bones. That's what the pubic symphysis is. Menisci is the plural form of the word meniscus, which I imagine a lot of you have heard that term before. Anybody know where you have a meniscus? In your knee. Actually, you have 2, one medial and one lateral meniscus. When somebody tears cartilage in their knee, that's probably what has been damaged, is their meniscus. And then portions of tendons also have fibrocartilage associated with them. All right, we've got 4 more connective tissues, and I just threw them in here on this next slide. For really the only reason is just to save paper. Up at the top, we're going to talk about the 2 forms of bone, and then at the bottom, we'll talk about blood and lymph, our 2 liquid connectives. Okay. I'm going to just write those out as well. All right, we'll start with bone tissue or osseous tissue. It's also known as very hard form of connective tissue. Involves mature cells called osteocytes embedded in a unique matrix with lots of collagen fibers.
and mineral salt crystals. We all know from an early age in life that to have good, strong bones, we need to get what? Calcium. When I say mineral salt crystals, that's calcium among some other things. That's where the true strength of bones come from, okay? The matrix of bone is very similar to cartilage, but harder and more rigid due to those mineral salts. There's two types of bone, compact bone and spongy bone, which also goes by the term cancellous bone. It's probably surprising to a lot of you that our bones, whether you're talking about like the big femur bone in your thigh, or even like your tiny little finger bones, they're not solid structures all the way through. They're hollow structures, the biggest space on the inside of them. The compact bone is the shell of your bone. It's what is the strongest part of your bone, but it doesn't go all the way through the bone. Okay. Both the cells and extracellular matrix surround vertically oriented blood vessels. And yes, there are blood vessels that run up and down and through our bones. Those are found within a cavity in what's called a central canal of each of our osteons, which are the structural units of compact bone. Okay. Spongy bone gets its name not because of its texture. It's not soft like a sponge, but it looks like a sponge. Okay, looking at the figure, you can see kind of the red in our illustration, not illustration, but picture. That's the bone tissue, and the spaces kind of there in the whitish, reddish parts is where you're going to find bone marrow, red bone marrow that provides us with the production of our blood cells, okay, which we're going to talk about those here in just a second. Okay. We find spongy bone on the inside of our bones. We find a kind of at the ends of our long bones. We're going to talk more about these two types of bone and bone tissue. We actually have a lecture called Bone Tissue. That's the very first lecture of Unit 2. So we'll see these things in much greater detail and learn a lot more about bone at that point. We also have an entire lecture dedicated to our blood, okay, which will be in Unit 6. But this is our Unit 5, somewhere in that neighborhood, somewhere a few weeks or months down the road. But this is a connective tissue existing in a liquid state. Key feature of blood is it does not contain any of those fibers. So there's no collagen, there's no elastic fibers, no reticular fibers. And that's good because fibers could cause your blood to clot. We don't want our blood normally clotting, okay? We want our blood to be nice and liquidy with this fluid called plasma that suspends and holds the what we call cells of our blood. The form elements they include, and most numerously, are the erythrocytes. Commonly, we call those our red blood cells, RBC, short for red blood cells. Those are what transport our oxygen and carbon dioxide. Then you got leukocytes, which include like the eosinophil. They're labeled this basophil down there, a lymphocyte. They are most commonly called our white blood cells. WBCs is short for white blood cells. They provide us with various immune functions. And then the little purple dots that you kind of see sporadically, those are our platelets, or also we call them thrombocytes that are going to be helpful when we want actually our blood to clot, like when we get cut. Okay. Now it's not labeled, but you might put in parentheses that this is blood. It's not a picture of lymph. And I don't have a picture of lymph for you guys to know for the exam, and that's okay. But this is extracellular fluid that flows in lymphatic vessels. It's liquid connective tissue made up of several types of cells and a clear liquid extracellular matrix, similar to our blood plasma, but with much less protein. Composition of it will vary from one part of the body to another. We'll talk more about lymph when we get to the lymphatic lecture toward the end of the semester. So that is all of our connective tissues. Before we move on to our last two types of tissues, muscle and nervous, I want to talk about what we call epithelial membranes.
Okay, an epithelial membrane, just based on its name, should be pretty obvious that we're going to be dealing with epithelial tissue. What is an epithelial membrane? It's a continuous multicellular sheet of not just epithelial, but also connective tissue. Okay, so I would highlight epithelial and connective. Okay, so it's these two types of tissues, like I was showing you back on this slide. This would be showing you an epithelial membrane because we've got epithelium and connective involved. Okay. Since we have two tissues, this is technically an organ. Okay. There are four types of epithelial membranes in the body. First, what we call mucus or mucosa membrane is going to line a body cavity that opens directly to the exterior. So in other words, the digestive, so this would be like your inside of your mouth, inside of your nose, respiratory, urogenital, so like the inside of the urethra, which is the structure that carries urine out of the body. Key feature is that they are connected to the exterior. And we call them a mucous membrane because in many cases, not all, but most of the time they secrete a fluid called mucus. Okay. Mucus is not just released in our nose. Okay. Similar to those are serous membranes. The key here is that they are associated with a body cavity that does not open directly to the exterior. So these do open in the exterior, these do not. Okay. We've already talked about serous membranes. Remember, they're made up of the two layers, parietal visceral, and are associated with like our heart and lungs, the pericardium, the pleura, the peritoneum. We've already been talking about those. Okay. A cutaneous membrane is just another way to describe your skin. It's just a fancier term for skin. Covers the entire surface of the body, made up of a superficial portion called the epidermis, a deeper portion called the dermis. We'll talk about that on Thursday. There's a dry membrane. All the rest of these are not. The final is what we call a synovial membrane, which is always going to be associated with our freely movable joints, something as complicated as our shoulder or our knee, or as simple as like, between the tip of your pinky and the middle part of your pinky, where we can, bend our joint there. Okay. This type of membrane actually does not have epithelium, is only going to contain areolar connective tissue, and is always going to have a fluid called synovial fluid, which is important for lubricating that joint and allowing for free motion to occur. 4 images at the bottom, just from your textbook, I included them. No other reason. Don't worry about studying them for the test. They won't show up on it. All right, that then brings us to muscle. Key feature of our muscle is that the cells have the ability to, once stimulated, contract or shorten, enabling them to do things that require physical chemical force, like moving our limbs, which is what our skeletal muscle does, or moving something internally, which is what our other two types do. Cardiac muscle found in our heart, smooth muscle found throughout the body, like the inside of your stomach, intestines, blood vessels. We have an entire lecture. This is the first lecture of Unit 3 dedicated to muscle tissue. It's actually called muscle tissue. We'll spend the majority of that unit talking about skeletal muscle. Looking at this figure, kind of looks like it's blurry. Okay. And that's not an accident. That is because skeletal muscle tissue has these little light, dark bands, what we call striations. Okay. And we'll find out why that is later on the semester. You don't quite see them as well here in cardiac muscle tissue, but I promise you cardiac muscle tissue also has striations. Okay. Cardiac muscle also has these little dark lines that you can see, and that's unique to them. Those are called intercalated discs. Okay. So they are, in other words, only found in our heart muscle cells. Smooth muscle gets its name because it's non-striated. It does not have those light dark bands. Instead, it is smooth in appearance. Okay. And we'll talk about it at various points when we talk about like our stomach and the intestines, our blood vessels, because that's where we have smooth muscle. Last slide we can get through real quick and then we'll call it a day. There is only nervous tissue. There's no multiple forms of nervous tissue. It's just nervous tissue. Okay. This is the most complicated of our tissues because of how it works. Its function is insanely complicated due to the ability or what enables us to rapidly communicate within the body. Characteristic of being very excitable and conductive. Excitable means that it can create nerve impulses, and conductive means that it can send them long distances, like from the brain all the way to the tip of our toes. Now, the cells that do that communication, the nerve signaling, are these big blobby ones, what we call neurons. They are made up of what we call cell body, long axons and stringy looking like dendrites. Okay, little specks here that you see periodically, those are the supporting cells, what we call neuroglia. And there's 6 different types of those. We have an entire lecture dedicated to these, or this tissue. We have what's called nervous tissue. That's, I think, unit 4. So we have that to look forward to in a few weeks. So for now, we'll just kind of leave it at that. Okay, any questions?